Tonight we will be starting from a pain management perspective. We will be jumping first into oncology massage. So let me share a little bit about our first speaker this evening. So Melissa Faith Baun is a board certified licensed massage therapist, as well as a certified lymphedema, decongestive therapist, and certified manual lymphatic drainage therapist. She's a provider for both the Society for Oncology Massage and Unite for Her. She is a CE instructor for the Society for Oncology Massage and National Certification Board for Therapeutic Massage and Bodywork. Her primary work is devoted to lymphedema management and radiation-induced fibrosis treatment, as well as oncology massage. She's also studied mastectomy massage, and although much of her practice is devoted to breast cancer, Melissa works with patients diagnosed with all types of cancers and lymphedema. So it is my pleasure to bring on our first guest this evening, Melissa Faith Baun.
Thank you so much, Erin. It's such a privilege to be here with you all. I was sharing with Erin earlier, I don't even know how many years I have been volunteering with Unite for Her, working as one of their providers. It's an amazing organization, and I always look forward to opportunities like this to share something that's so near and dear to my heart, and that's oncology massage and lymphedema management. So Erin shared a lot about you, but I'm going to tell you exactly how my change of career started. It was in 1998 when I lost my father to cancer, and it just seemed like there was something missing in his care. He couldn't take certain medications. He had bad side effects. His pain wasn't managed well. And at the time, I was working, actually intending to go back to school for nursing. I was originally a psychology major and worked as the admissions director of a nursing home for many years. But the hospital that I was at started integrative medicine task force. I hopped on it and quickly realized that oncology massage was where I wanted to be, particularly watching my father's experience. So what is oncology massage? How is it different from regular massage? Almost everybody usually says at one point in their life they've had a massage. A Swedish massage is what we usually refer to as a regular massage. So oncology massage is just merely the modification of existing massage therapy techniques that we do in order to safely work with complications of cancer and cancer treatment. We are so fortunate in the United States. We only have one organization. It's called the Society for Oncology Massage. And this information will be shared with you later on a page, how you can visit their site and get more information. They're our only organization in the United States, although they're worldwide, that oversees the guidelines for how oncology massage should actually be taught and delivered safely and effectively. There are 18 instructors worldwide, 12 in the United States. I have the privilege to be one of those 12 instructors. And what I love again so much about Unite for Her is that all of their massage therapists that are providers have been trained under the Society for Oncology Massage guidelines. So y'all get the gold standard when it comes to massage care when you are using your passports for massage through the Unite for Her. So there's also a position statement that the Society for Oncology Massage has put out, and I know Erin shared that that will be posted for you all to read. But I'm just going to briefly tell you that this position statement states that oncology massage is deemed applicable at all stages of the cancer process, from initial diagnosis through treatment, during recovery and rehabilitation, and throughout remission, and at the end of life. So basically, there's no time that oncology massage is unsafe for anyone going through cancer treatment. There might be a few reasons why you wouldn't necessarily have a massage if you are going through cancer treatment, one or two complications, but really that's it. At no time other than these one or two complications, which would be, a fever would be one of those, would you not be able to actually enjoy this amazing modality that has so many benefits to it? And many of them involve pain management, which we're here to speak about tonight. So we basically just make an adaptation of our strokes and our touch during oncology massage. Most of them are going to really be not noticeable to anyone receiving that massage. There's a few that might be obvious. So if you're someone that's been used to having a deep pressure massage prior to a cancer diagnosis, you're going to notice that you're no longer going to be offered deep pressure massage by a trained oncology massage therapist. And there's lots of reasons for that. It's really not good. Deep pressure causes inflammation. Cancer is a disease of inflammation. Your body's working very hard to heal itself and to heal from the side effects of treatment. And the last thing that needs to happen is you have something now that's going to injure your body. A lot of people don't realize that's why deep pressure is not delivered during oncology massage. So the goal of oncology massage is really to aid in offsetting both disease and treatment symptoms. The strokes work to engage your parasympathetic nervous system. So this is your nervous system that actually makes you feel good, right? This is your nervous system that helps you to feel calm. It's when you're just feeling really pretty good. So there's certain strokes that we can deliver that actually helps engage that parasympathetic nervous system. It stimulates those feel-good feelings. And while it does that, it simultaneously quiets your sympathetic nervous system. So your sympathetic nervous system is named incorrectly, really, because it's your nervous system that makes you not feel good. It's your fight or flight response. It's your anxiety, your heart beating, you're trying to catch your breath. So we're aiming to quiet all of those sensations and really just induce your feel-good sensations with your parasympathetic nervous system. So a question that commonly comes up when I speak for Melissa Christie on wellness days is patients will often say, I heard that oncology massage isn't safe, that it can spread cancer. This is simply not true. And this is why I do address this in every talk, because no one should be denied such a wonderful modality that can help them feel good, that can help get them out of pain, because of a myth that is circulating that says massage will spread cancer. It has never been proven. It really is not known where the myth actually came from, although there were several theories. But please know that this is untrue. If it were true, the basis behind that is massage increases circulation. So then we would be telling you not to exercise, right? We would be telling you not to get a shower. We would be telling you not to walk down your steps. There is no basis for that. So again, anyone really, other than one or two contraindications, is able to have a massage at any point during their oncology treatment. So oncology massage came to the United States, and I do see something in the chat about lymphatic drainage. I'm going to address that at the end, and then if there's any specific questions, I will definitely come back to that. It was Canada who shouted down to the United States in the 90s and early 2000s and said, could you all please get with the program and start touching people with cancer? There's lots and lots of benefits that can be had. So that's really when oncology massage was born here in the United States. It's relatively new. I actually went back to school in 2000 to become a licensed massage therapist. And then I studied out at MD Anderson in Houston, who has a program also accredited with the Society for Oncology Massage to do my oncology massage training. So let's talk about what does research actually show as to what oncology massage may be beneficial for. So a lot of research, and I have actually made a list of all the websites that has done this research, peer-reviewed, third-party reviewed, that is now showing that oncology massage may improve the quality of life for a person, certainly helping to reduce anxiety that so many people feel with a cancer diagnosis, help with management of pain. And I'm going to talk a little bit more about how we address that with certain strokes. It may help improve the quality of sleep for many patients, improve fatigue. So it will help reduce that fatigue that a lot of patients actually feel during the disease and the treatment. A lot of people taking certain types of chemotherapy will experience something called chemo-induced peripheral neuropathy. And that is that tingling of your hands and your feet and those funny nervy sensations. It will often subside after the chemo is stopped. Sometimes it takes 2 years, but for others, it never goes away. We're going to tonight do together a whole protocol here that you can learn to help with those sensations. It does not take CIPN away, but it definitely helps to reduce those sensations that you feel. Oncology massage might help with side effects of some of the aromatase inhibitors and all of the side effects that they can present for many patients. It can help increase function in the areas affected by scar tissue from both surgery and radiation. It can help with post-surgical swelling, which again can be quite painful. You can feel that heaviness there. Help support rehabilitation and recovery, and definitely help support the lymphatic system. So if lymphedema is something that you're experiencing with your cancer treatment, that's a little bit different. Manual lymphatic drainage is different from oncology massage, but it can be addressed by somebody who is duly trained in oncology massage as well as a proper training in lymphedema. So pain from cancer and cancer treatment can manifest two ways. It can manifest physically, but it also can manifest emotionally, right? We often think of the physical pain that we feel, but what about that emotional pain that I alluded to earlier and the anxiety that comes along with that? So how can oncology massage help with the emotional pain and suffering? When we perform oncology massage and we alter the pressure and the rate of the strokes that we use in touch, this touch often helps to have a person begin to feel less anxiety, feel like they're sleeping a little bit better, and really feel like they're feeling, a better well-being about them. So oftentimes in the privacy of a massage room, when these strokes are being delivered, it's a great way for that person to be able to really safely release their emotions. And it's okay to do that. It's okay to cry. It's okay to be scared. So many patients feel they have to hold this in and be very strong for their family and their loved ones, but they need a place to release what they're feeling as well. And a lot of times it's just that someone becomes so relaxed, they might fall asleep, or they might realize, oh my gosh, my heart's not racing anymore. I don't feel that anxiety that I felt when I came in here. So that can help again in having them sleep better that evening, feel a little bit better. And then we talk about the physical aspect of pain in both cancer and cancer treatment. So physical pain is a big side effect of cancer and treatment. And again, we're going to modify some strokes that can be very beneficial in engaging that parasympathetic nervous system. We're going to use light touch. We're going to use gentle ringing. We're going to use a feathering stroke, light effleurage, light scalp massages, hand and foot massages where appropriate, and just strokes that, again, are going to really engage that parasympathetic nervous system. And when that happens, that becomes the foreground music, so to speak, and that fight or flight response, that anxiety kind of becomes the background music as you're sinking further into that massage and receiving strokes. And I always like to share a story of a patient that came to me, oh my goodness, 2 decades ago. She was going through treatment for rectal cancer and was in the process of finishing up her radiation therapy. Excuse me. And she was in a lot of pain. She couldn't sit, she couldn't get out of pain, and she was beginning to get a lot of anxiety. Someone had referred her to me, and I really wasn't sure. At first, it was kind of we're going to feel our way together. She was not able to sit comfortably. So the first thing that we do in oncology massage is how can we position that patient so that they can be comfortable on our table or in a chair. And we found a way for her to become comfortable. And honestly, for 1 hour, I just began very lightly touching her, using those feathering strokes, using those light ringing strokes, using that light effleurage. And by the end of the hour, she actually had tears running down her face. And she said, "This is the first time in 5 weeks I haven't felt pain." It gave her enough relief that she could go on for a couple days and really carry that benefit with her. And that is so important. It helped get her through her last treatments of radiation. So another thing that I talked about earlier is chemo-induced peripheral neuropathy becomes really problematic for a lot of people. So Erin, if you could share the protocol on the screen, maybe. I want to walk everybody through that real quickly. Okay. Yes. Awesome. So some patients will experience CIPN only in their hands or only in their feet. More commonly, it's the feet because that's the most distal part of the body. It's where the chemo just kind of saturates those blood capillaries and leaves this very unpleasant feeling. And so you can start on any finger, any toe. It doesn't matter. But what you're going to do, I'm just going to use my hand as the example so that you all can see that, right? Doesn't matter whether I start on my thumb, doesn't matter whether I start on my little finger, but you're just going to follow five either way. And you're just going to do some light massage on your hand or on your foot to get it warmed up. You can use some nice olive oil at home. That's a great medium. If you have some really nice massage cream at home, use that. And then you're going to walk, whether it's your foot, you would do your ankle, or your hand, you do your wrist, and you're just going to come up a little bit further up that leg or up that arm. And all your strokes are always going to go up towards your heart. So we're not going to stroke back this way. We're going to stroke towards our heart. That's whether we're working with our feet or with our hands. And then we're going to pick, like I said, you can start with your thumb, you can start with your finger, and we're going to take our forefinger and our thumb of our other hand, and on the outside and inside of your finger, you're going to do a little pinch and circle. And you're going to do that 1, 2, 3 times. And then you're going to move down about a fingernail width. And you're going to do the same thing. 1, 2, 3 times. And you're going to go all the way down till you reach the end of your finger or your toe. And then you're going to come in and you're going to, the same thing with the outside and the underneath, the top and bottom of your finger, 3 circles. And you're going to work your way down. And you're going to do that 3 times. So 3 circles, 3 times on each finger, each toe. And then when you're done, you're just going to use some light compression again and light massage. And then you can go on to your next hand or your next foot. That helps decrease that neuropathy sensation. So CIPN isn't a true neuropathy, but it feels like a true neuropathy in a lot of ways. So that's going to help decrease those sensations. And if it's something that somebody, actually, Erin, I was just thinking of this, if this is something that really you would like me to come back and just do a whole segment on for a half hour, an hour, I'm happy to do that to teach anyone all over that wants to learn this. It's a really wonderful modality. So anyone that was trained with the Society for Oncology Massage will know this protocol because it's mandatory that we must teach this to all the massage therapists. So anybody that you're seeing with Unite for Her for massage therapy will know that protocol and be able to do that for you. And absolutely have a loved one come in with you, a family member, a friend, and you would be able to have them sit right next to you and learn how to do this so that someone can do that for you at home. And I know I'm running out of time and we have to leave question or time for questions. So the only other thing that I really wanted to talk about was some scar tissue that if you work with a trained massage therapist, so this is a little more training that's involved in what we can do in our 4-day course that we teach for the Society for Oncology Massage. Some advanced training in scar tissue can actually help minimize pain. There are a lot of trained massage therapists out there. I myself, scar tissue is one of my favorite things in the whole world to work on. It can be softened. Patients are often not aware of that, particularly if it's radiation fibrosis and it begins to harden. Not everybody picks up on that, both medically and patient-wise. And a lot of times it's just a little bit of work to help soften and break up that fibrosis. And then lymphedema can be a side effect of cancer treatment for having lymph nodes removed, having them radiated. If you are diagnosed with lymphedema, you always want to first go to the hospital, hopefully that you were treated has a lymphedema department. If for some reason you have trouble finding a lymphedema therapist, you can feel free to reach out to me. My information will be on here. I can help direct you for where you live, and be assessed and be properly treated. And then you will probably require some maintenance from there on out. So that's a little bit different than just oncology massage. But as I said, many oncology massage therapists are becoming trained, duly trained now in manual lymphatic drainage, and they can work with both for you, which is a nice benefit because lymphedema is a disease. It's not going to go away. That heaviness, all of those things that you feel can help be alleviated with a trained oncology massage therapist and lymphedema therapist. So I know, like, I think I've gone a little over my time. I want to open up for any questions real quick before they have to kick me off the screen and let Diane come on.
No, that's okay. I will say maybe at the end, if we've got a few minutes, just because it may have been a little bit difficult to see you demoing with the sharing of the
Yes.
screen of the instructions. So at the end, once Diane wraps up, maybe we'll have you do a quick demo again
Awesome.
when you're
Yeah.
spotlit, just to go through that technique again, because we want to make sure everyone's doing it correctly for sure.
Perfect.
Okay,
Question.
How can
wonderful.
we get in touch with you?
You know what, Erin, will you put my information up?
Absolutely. We'll pop that right in the chat. Do you want me to share your email?
Yep, email and phone number is fine.
Okay, perfect. We'll do that. We'll pop that in the chat for you.
Perfect. Thank you.
You're welcome. And if you want to answer some questions in the chat, we can pop over to
Yes.
Diane and
Perfect.
we'll get started on our next topic. Thank you so much, Melissa.
Thank you, everyone.
You're very welcome. All right. So we are very excited to bring in our next Unite for Her provider, and another important discussion on how integrative therapies can support pain management. So Diane Kistler is a certified yoga therapist with specialties both in chronic pain and cancer. She became a 200-hour certified yoga teacher because she saw yoga as a way to deepen her own practice and a way to share tools with others for healing and resiliency. In 2018, she graduated and earned her yoga therapy certification from the International Association of Yoga Therapists. She completed the Professional Pain Care Distance Mentorship Program as a certified pain care educator and serves as a trainer. She's a founding partner in the Pain Care Collective. I'll be sure to share that link as well in the chat, which is an online yoga therapy studio for chronic pain. And she's able to reach more and more people through that organization. So again, it is my honor and pleasure to bring in our next expert this evening, Diane Kistler.
Thank you so much, Erin. Thank you, Catherine. And it is my extreme pleasure and honor to be with here to share meditation for pain management. So I've been working with the cancer community for about 20 years, beginning with the cancer community of Philadelphia. I've also had my own cancer journey, and I can attest to how both meditation and yoga has supported me through those. So this is why it's even doubly an honor to be here, because I want to share it as much as I can. So I'm going to share my screen. I actually do have a presentation. It's up here. And I want to just take you through. I kind of get a little geeked out. I hope did that show up? I think it brought
It
something
did
else.
not.
I'm gonna share again.
Mhm.
Okay. It's showing your logo. It loves you.
That's okay.
Okay, let's try third time. No, maybe you could share that for me. Do you have it up?
I do. I do. Yeah, I'll share and then you can just walk me through it, Diane.
Okay, thank you.
Yeah. How's that
Excellent.
look?
Great. So we'll just go through that to the full screen, and we'll go
Does
to
that look
this.
good?
Yep, it looks excellent. We'll go to the next page. All right. So this is basically the goal of yoga. And I will not, well, I'll say it in Sanskrit, Yoga Sita Vritti Nirodha. And it's the restraint of the fluctuations of the mind. These are the guidelines for practicing yoga. And, meditation is not the realm of yoga. Like yoga doesn't own meditation, but it is definitely a part of the yogic tradition. And this particular one, as I said, is the goal. And we can get to the restraint of the fluctuations of the mind through meditation, through movement, through breathing, through a walk in the park. So all the things that you see about yoga, movement, breathing, mantras, meditation, it's to quiet the mind so that we can come back to the true essence of what we are, that we're not this mind, we're not this body, and we're not this disease. And we'll go to the next one. So I share that with you because it's very important. This is where we're trying to do. So we'll come to the next slide. So there are aspects of our being, and we take a whole person approach to pain. We look at the body and what sensations of pain and discomfort you're feeling. You look at the amount of energy that you have. You could be feeling lethargic, congested. There's circulatory issues, nervous system implications. Your mind, are you going through depression, anxiety, shame, guilt? What are your limiting beliefs? And this is all related to when we're in a painful situation or have chronic pain or from cancer, all these things may come up. Then we also look at our wisdom and intellect, where we're saying this is a judgmental, this is good or bad about what we're feeling in our bodies, and fear. And then finally is our connection, which is the last kosha or level of our being, is our connection to purpose, something bigger than ourselves. And when you have a condition like cancer and you have pain either from your cancer or from something else, there's this wonderment of now what? Who am I? What is my bigger purpose? And I bring this up because pain affects all of those aspects of our being. But the good news is, and I go right to the good news, is that we can affect all those aspects of our being ourself. And I love this quote from Neil Pearson, who is my colleague and mentor. If we change any aspect of our existence, we change any aspect of our existence. Okay. So we're going to go to the next slide. Thank you, Erin. All right. So understanding pain, and I'll just give you a real quick, the purpose of pain at all times, and it doesn't seem fair, is a protective mechanism. Okay. It may not feel this way, but just think of the hot stove example of, a young child putting their hand on a stove and they pull it back. that at its most basic elementary level is the purpose of pain, to protect us. It sometimes doesn't feel that way. It becomes overprotective, and we'll talk a little bit about chronic pain. But it makes you stop what you are doing, get away, rest, take a break, or change what you're doing. So it's very intelligent when it's working in an acute sense. And it also works on a priority basis. So it tends to those things that are most important for your survival. So it's a basic survival mechanism of our brain. Okay. Phantom limb pain doesn't make sense, but that is a protective mode. So Erin, we'll go to the next one. Thank you. So I just wanted to give you kind of this is where I geek out. This is the pain system in an acute sense. Okay. It begins with a force or something in your body, whether it's a mechanical force, a chemical, a thermal force that happens. I'll just use, stubbing your toe as an example. That's a mechanical force. There's some type of, and that begins this process of sending signals up through the body into the spinal cord and finally into the brain, as you can kind of see the arrows here. It's a process of nociception, if you understand that. And it goes through the spinal cord, this danger signal, and then finally to the brain, to all these different areas. There's not one brain area in the one area of the brain that's just for pain. But what happens is that the brain produces pain based on a complex range of inputs, again, as a protective. And then the brain sends a pain signal back to the area of injury. Now, this takes place like very fast, under the radar, under your conscious level. But some of the factors or signals or inputs can be memory. Have I been here before? Have I stubbed my toe before? Emotions. Was I really angry or stressed when it happened? Okay. And environment. If there's loud music, is that going to affect if I'm going to feel pain? Okay. So this is it kind of in a really fast nutshell, that it is a danger signal from the site of injury all the way up through the spinal cord and all the way up through the brain. So I'm very much simplifying it, but I hope that can kind of give you an idea, at least on acute sense. Okay. And then if we go to the next slide, we'll just jump into the nervous system. Okay. So signals can be inhibited or kind of damped down from both the brain and the spinal cord. So we have this ability in the body to modulate those both danger signals and pain signals. So danger signals coming up and pain signals coming down, okay? And there are these wonderful chemicals called neurotransmitters like GABA and other natural opioids in our body that we produce that can inhibit pain signals or danger signals, okay? And guess what? This is where we get into meditation, is that is one way of increasing the production of the GABA, okay, in the first part of the brain, okay? And it can help prevent the overstimulation of the nervous system and anxiety as well. So although some signals can be facilitated, but we're talking about meditation as that practice to inhibit some of these both pain and danger signals. And then we'll go to the next slide, Erin. Thank you. So when pain is chronic, usually injuries heal within 3 months. So if you're still having pain after 3 months, it's usually a chronic issue. And it is remembering that there's so many different inputs for our brain. It's a biopsychosocial thing. I was going to say disease or a thing, condition. Any inputs to any part of ourselves affects our pain. And then pain also affects all parts of ourselves. And I'm just wondering if that really rings true for you, you know, if you got a call and it just made the pain worse, or you didn't sleep and it made the pain worse. Our alarm system in a chronic way is hyper vigilant. So it's always looking for signs of danger when perhaps there are none. Okay. Pain also, I just want to include this, doesn't mean that your body tissues are injured or hurt, okay, all the time. And it's always, I just want to reiterate that it's always a signal from your brain to protect you. Okay, we'll go to the next one and the next one too. So we're going to come into the meditation part. So very similar to Melissa's presentation on massage, that there are a host of wonderful benefits, and it creates less pain, less perception of pain, because pain is a perception, and it creates safety. So there's less fear of moving, creating more safety around your nervous system, so that maybe you'll try to move a little bit more or try to functionally get out in life. It can reduce overall stress, you know, better everyday QOL functions, and also giving you connection and joy to your purpose. Focus and concentration is a big one, and it can support the sleep. So I love how this overlap of just very different modalities, but it's really working with the nervous system. The one thing I do want to say is that there may be some adverse effects to meditation. There was a 2022 study which related some adverse effects in a population, and things that, you know, may come up is if there's any buried trauma, or if there's any heightened anxiety or depression, or if you're looking for this complete, you know, serene and peaceful feeling, but it's not coming. So there's like an anticipatory, or even if you have discomfort in sitting in meditation. Okay. But what I would suggest, if you want to try meditation to help with your pain, is approach it with a sense of curiosity, an open mind, and letting go of any judgment that it should be a certain way. Also incorporate maybe some body practices or body movements to make sitting in meditation. And I say sitting, that's not the only way that you can have to meditate, by the way. But to make that time a little more comfortable, and make informed choices of what meditation style that you choose, as there is a lot of different meditation styles. And what we're going to practice today are 3 different ways of getting into meditation. So we'll go to the next slide. Thank you. So in yoga, there are 8 limbs. Okay, and limbs are just ways that we come into that first sutra. I think it was the first slide about restraining the fluctuations of the mind. Okay, we can do that through movement. We can do that through breathing. We can do that through meditation, of course, or spiritual connection. But these last 3 are the ingredients of meditation. And the first one is pratyahara, which is actually, if you've heard of the word interoception, which is an inner awareness, sensory awareness coming inside. So it's when you feel maybe your belly rumbling, or when you feel pain, you know, that can be an interoceptive inner awareness. So that's the first thing that needs to take place when you're coming into a meditation practice. We can notice a painful area, but not judge it or create stories or even fear it. Okay. The second is dharana, which also helps with self-regulation to influence the pain experience. So it could increase our pain tolerance and also neutralize the sensation of pain. So it's a cultivation of focus and concentration. And the third key ingredient, and this is meditation. In yoga, this limb, dhyana, is the practice of meditation. So we're moving from the outward projection of our mind and our senses inward towards ourselves. And with this, we're providing the capacity to adapt and sustain a sense of equanimity or balance. Okay, equanimity is that ability to go through the ups and downs and then come back to maybe the ground, the foundation. And also one becomes more resilient over time. So those are the three key ingredients, and they are 3 of the 8 limbs of yoga. Okay, and we're going to practice each of those. And I'm so glad we have a good 5 minutes. I think this will be a nice practice. So we'll come to the next slide. And the practice today is the first one, which is the pratyahara, which is, bringing everything in, is called alternate nostril breathing. The second one is a body scan, which is a form of mindfulness. And the third one is going to be a meditation using a mudra for focus. Okay. So I invite you now to find a comfortable seat. So if you have to just kind of move your body a little bit, place maybe your feet on the floor or on a surface which feels supportive. And the alternate nostril breath is using your hand, your right hand here, and it's going to be breathing in through one side of your nostril and out through the other, and then breathing out through that other and in through that one and out through that one. If you find that it's not available, you can also visualize the breath moving in and out of each of the nostrils, okay? Because sometimes they're not clear. I always have a tissue in hand just in case. So if you need to blow your nose before or after, please do. This also tends to regulate our sympathetic and our parasympathetic nervous system. So we're just going to try about a minute of this to just kind of prepare us for the final meditation. So I invite you to take your right hand and place your thumb here on very lightly, just enough to close the right nostril. The other fingers can rest at the space between your eyes or on the bridge of your nose. And you're going to breathe in through the left nostril as long as you can, that's comfortable. And then you're going to close that left nostril, open the right, and breathe out through the right nostril. And then continue with that, breathing in through the right. Gently close it, not too much pinching. Breathe out through the left. And if you would like, take 6 more rounds of this breath. So each time we go and finish right and left, that's 1 round. Be comfortable. You may also realize that as you're going through this breath, that one of your nostrils may open up. During the day, our nostrils will take turns as far as being closed and open. And just a few more rounds, maybe 2 more rounds. Your eyes can be open or closed. And I always begin my own meditation practice with a breathing practice. Sometimes it's this alternate nostril, and sometimes it's just a 3-part breath. It brings more energy and circulation to my body. Good. And when you're done, you're breathing out through the left nostril. And then I invite you to lower your hand and just breathe through both nostrils and notice how you feel. If you need to blow your nose, go ahead and do that. So the second ingredient for meditation is to just kind of go through a body scan, which I'll take you through, and we're going to just lightly touch your mind on the different areas of your body. So again, be comfortable, let the chair or the couch support you, feel your feet on the floor. Your eyes can be open or closed or just soft. And bring your awareness to your feet. Notice your feet. Let your feet dominate your awareness. Notice any sensations there. And then bring your awareness to your lower legs. Notice any sensations there. And bring awareness to your upper legs, any sensations that may be there. Bring your awareness to your pelvis. Bring your awareness to your ribs. Gently guide your awareness to your chest, your low back, your mid back, and your upper back. And guide your awareness to your hands and fingers and thumbs, to your lower arms. Guide your awareness to your upper arms and your shoulders. And bring your awareness to your neck. And then to your face and all the features of your face. And bring your awareness to your whole head, whole body awareness. So as you become aware of your body, you make those adjustments to prepare for meditation. And the meditation that we're going to use a mudra for focus. And this is called Dhyana mudra. Let me just show it to you. You're going to have your right hand on top of your left. So hopefully everybody can see. And then the thumbs will touch. Okay. I don't know if that's clear or not, but right hand on top of left. And then you can rest both hands on your lap with the thumbs touching and the right hand on top of the left. And if it is comfortable, you may close your eyes or just soften them a little bit. And this particular mudra facilitates full yogic breathing. So as you breathe in, notice your breath in. As you breathe out, notice your breath out. And for about 30 more seconds, just notice maybe the space between the breath in and the breath out. And it's in that space that we create space between the thoughts. And as you rest in the stream of meditation, easily body, breath, and mind are integrated naturally. Take 1 or 2 more breaths. Then when you feel ready to release that mudra and maybe blink your eyes back open, coming back to the room, I can share the name of that mudra, or I don't have an image, but I can share the name of it in the chat or share it with Erin. So we're going to go to the next slide, Erin. So when you're in pain, these are just some steps that you can take, just kind of your own little mini meditation, is just witness the pain experience that you're having and maybe begin to let go of some unhealthy habits of coping. right? Where we hold tension in the body when we're in pain, or we hold the breath or breathe, very shallow, or muscular imbalances. So notice those, notice where the pain is, and see if you can let go of those and incorporate maybe that alternate nostril breath or a 3-part breath. And also, as well, cultivate awareness through not attaching to that pain, that pain is not you. Okay, that is your brain trying to protect you, but it is not you. And we'll come to the last slide. All right. So thank you very much for allowing me to be here and explore meditation for pain care. If you have any questions at all, you may contact me at all of those ways. And Erin, I think, was going to or has put up the Pain Care Collective website. We on the Pain Care Collective, we have a full slate of meditation practices as well as movement and breathing. And we also have a 1-month free trial, which is unheard of. So that will give you an opportunity to try out some of those live or on-demand classes. So thank you very much.
Wonderful. Thank you. And we'll put your website and your email, Diane, in the chat as well. So if members or anyone in the community wants to get connected with you.
Yeah. Were there any questions at all?
Let's see. Yeah. I don't see any questions for you. It'd be great if Diane can be a guest again in our speaker series to explain and speak more in depth about meditation and yoga. Absolutely, Marta. I love that. And I know we will be highlighting yoga specifically as another means to support pain management as well. We've already covered acupuncture and Reiki, and tonight we have oncology, massage, and meditation. So all of which you'll find in her library. I'll share that link as well, but know that that is coming specifically for pain. So you read our minds. Wonderful. Melissa, okay, so did we answer that question about the severe neuropathic pain in arms and legs? Yep, Melissa, we answered that. That's great. To guided versus silent meditation. That's a great question. Is there an advantage to guided versus a silent meditation, Diane? Great question.
Let me come back. I would say it's really a personal preference. I know that I've done both of those in groups. I've actually done silent meditations in a group and then also guided. And it really depended for me personally on my mind that at that time. Did I need to kind of have, because my mind was too busy and I was too anxious. So if listening to someone else helped me along that trajectory, to get there, then I would go for that. So, and there's a ton also. Insight Timer and Calm are great apps for that. And some of them are free. So you can find a lot and you can pick and choose. Yeah.
Wonderful. I love that. Okay. Well, with us being right at 6 o'clock, Melissa, maybe we can have you pop on and very quickly take us through again that self-massage. We'll bring you on. Perfect. Just very quickly as a demo that we can use moving forward, and then we'll finish up for the evening.
Okay. All right. So back to our hand is our sample. And we've warmed up the hand. So we've massaged the hand a little bit. And then we're going to start to move up the arm a little bit. And again, if this is your foot, you've massaged the foot, the ankle, and then you're just moving up that lower leg. Strokes are always in the direction of toward your heart. So you're never pulling down, you're always stroking up. And then we're going to pick whether we want to start with our little finger or our thumb. And on the inside and outside of that finger, we're going to pinch with the opposite hand's thumb and forefinger. We're going to do 3 little circles. And then we're going to move down about a nail's width and do 3 more circles. And a funny way to actually remember this, if everybody knows the Cookie Monster on Sesame Street, you know how he ate his cookies, he'd go yum, 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 yum. You can say that to yourself actually as you're working your way down your finger or toe with those 3 circles. And then we're going to come to the top and bottom of our finger or toe. We're going to do the same thing. We're going to do 3 circles, come down about a fingernail width, 3 more circles, and you're just going to work your way down that finger or toe until you reach that base. And you are going to do this 3 times. So 3 circles, inside, outside, top and bottom of your finger, 3 times. And then you're going to move on to your next finger or toe, and you're going to do the same thing. And it doesn't matter if you start on either side of your finger or the top or bottom of your finger or toe. That's okay. That doesn't matter. Whatever you're comfortable with. And you're going to do those circles. And you're going to come back the other way. And you're going to circle down. And that pressure, it's not a hard pressure. So you want to feel the skin movement when you make that circle. You want to feel that skin. But you don't want to be squeezing. Let me see if I can, squeezing that finger so you're really indented like that. That's too much pressure. It's a nice, soft pressure. It should feel good. It should never hurt. And you're just going to work through all of your fingers and toes, doing that same thing. And you can go nice and slow. You can go a little bit faster if you'd like. Just don't go too fast because you'll miss the benefit of it. Slower is going to tend to put you in more of that relaxed state. It's a slower touch. But if you're really feeling those symptoms and you're like, geez, I got to do something. I've got to put my feet, my shoes on. And I want to try to minimize those symptoms. It's okay to speed it up a little bit. You're still going to get some effect. You just, as I said, don't want to go too fast, but the slower you go, you are going to just induce more relaxation with that slower rate. And then you're going to finish all your fingers or all your toes on that one hand or foot. And you're going to come back again and you're just going to massage. And again, olive oil is such a great massage medium. You can use just a little bit on your hands to help you get that glide. And then you're going to come from your wrist down your forearm, the inside and out. And that's going to feel really good too. And that's it. And then you're just going to move on to the next hand, next foot. And that's really just the simple process that it is.
I love that. And
oh, go ahead, Erin.
We'll put those instructions as well again in with the recording also.
Perfect.
So easy. That's wonderful. And I do have a question. So Tina was asking, Diane, I'll bring you up on the screen too. Will either of you we have an in-person wellness day in October. I'm not sure who Melissa has scheduled to speak, but will either of you be there at Terrain in Doylestown?
Oh, go ahead, Diane.
No, I will not, but if you want to invite me.
I'm not sure who she has on the schedule. I know she works through lots of our providers. So I'm sure that you'll be at one of the virtual ones or one of the upcoming ones, other in person that we have each quarter. So, but there's lots of videos about yoga, meditation, and Marta had a really great question, Diane, just diving a little bit more about the theory behind yoga and meditation. I don't know if there's any good resources that you can share for her to at least get started with maybe doing a little bit of learning or reading on her own.
Yeah, can I put it in the chat?
Absolutely. Yeah. Wonderful. But we will have really wonderful providers if you are joining us at Terrain. As you can tell, Melissa and Diane are representatives of our entire provider network. So they really are fabulous. And these are the expectations that we hold for all of our providers. We want them to be knowledgeable, experienced, and really comfortable working with the oncology population. So we hold all of our providers at very high regard. And you can see why. We have two incredible experts here. So whoever will be at Terrain and whoever you may connect with on your own, even if it's in person or virtually for our national members as well, we want you to have the highest quality experience with them.
And Erin, I will say, Melissa Christie actually asked me to guest speak at Terrain. Okay. Unfortunately, twice a year we teach for this Society for Oncology Massage, and that's the class we have that scheduled over that time. Yeah. I will reach back out to her because if she hadn't found somebody live, I said I would arrange for my co-teacher to be teaching that segment so I could at least speak virtually. I know they like live, and I'm close enough in proximity where I live. So I'll reach out to her again just to make sure I'm sure she's gotten some coverage.
Perfect. Wonderful. Okay, good. Well, if not, then in the future, I'm sure we'll see both of you. So thank you both for being here this evening and shedding a little light on these two incredible modalities and how they can play a role with pain management. We really appreciate both of you. And we Catherine put the list of all of our providers in the chat, but hopefully this was informative and we appreciate both of you.
Thank you so much.
Thank you.
You are very welcome. So that wraps up. Let me bring Catherine on. So that wraps up our virtual hangout for this evening. Hopefully, like I said, this sheds a little light on the power of integrative care and how that is so much more healing than just, providing us with relaxation, which is wonderful, but it really is truly impactful on overall health, including pain management. And like I said, we've already covered acupuncture and Reiki. So be sure to check out those segments from this spring, also available in our Her library. So you can do a little bit of learning about that as well. So I will one more time just give a quick thanks to our sponsors. Our digital education virtual hangout is presented by West, Merck, and Daiichi Sankyo with additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, now part of AbbVie. And Catherine, if you want to share a little bit again about your cafecito coming up, and then I'll share about our Ask the Experts that we have to wrap up October.
Definitely. Yeah. If you speak Spanish or have someone that speaks Spanish, definitely join us next month on the 14th at 3 p.m. Eastern time. We will be having Cancer and Careers and coffee or tea, whatever you prefer.
I love that. Wonderful. And we've got our Ask the Experts on the 24th, 1 p.m. Eastern time, how to manage tough conversations with children and teens with Jean Hartford Todd out of Duke. And then we've got October 30th at 5 p.m. Eastern time, cosmetic and medical tattooing with Mandy Soller of the Soller Institute. So hopefully we will see you then. Otherwise, thank you so much for joining us this evening. Catherine, thank you so much for being my esteemed co-host. And hopefully we will see all of you at a future segment. So take care. Enjoy the rest of your night, everyone.